Hey, welcome to the Go To Physio Lumbar Series Part 4. Now, what I'm going to give you today is my favorite hands-on treatment technique to desensitize the intercostals. So we've talked about in the previous lessons that when we go to touch our toes, we need the rib cage to move, we need the ribs to move, we need the diaphragm to stretch. And if we get all that stretching and moving, then the low back doesn't have to do half the amount of work. It doesn't have to tolerate half the amount of load. That can be very good to decrease the pain experience, get movement variability, and give your patient that confidence to feel light and springy again rather than rigid, slow, and cautious. So with that said, let's get into the content. I'll show you one of my favorite exercises or desensitization hands-on techniques to help your low back pain patients. I'll see you on the other side. Okay, so for the intercostal restoration, we can do quite a nice job in decreasing protective tone here. Now, the benefits of this is that the rib cage is going to be able to move a lot better, obviously, you'll have more available range of motion, and then obviously the diaphragm, pelvic floor can move, organs can move, and the athlete usually will feel like our patient will usually feel like they can breathe a little bit better. Now, the key thing with this setup here, okay, so obviously you've got your rib cage here, and we just want to follow the angles of the ribs basically, okay? So you want to basically just palpate through the, obviously you're going to have your big lat here, okay? So kind of anything anterior to lat will be really the main kind of areas that we're working on here. So I usually like to grab the lat just out of the way. Obviously don't pull it too much because then it'll be hard to get through down into the intercostals. What we want to do is we just want to palpate here for any tenderness. Now, if anyone has taken any bangs in the ribs before, that will be alarm bells for me. But what we just want to do is we just want to find if there's protective tone here, okay? And then what we want to do is we just want to simply sink into that tissue. Now, what I like to do, Pete, is just bring your knees up to the ceiling, or not to the ceiling, sorry, to your chest. To your chest, yeah, that's right. Okay, and then that's obviously going to lock up, okay, or limit the rotation through the lumbar spine. So what we're going to do in this scenario, okay, again, hand technique, I like to almost sink 2-3 fingers into between the two ribs, and then just put some force kind of in the transverse plane across the body towards the sternum, okay, following the angle of the rib. So what I will do is I'll just do that, and then Pete, I just want you to inhale as you bring this hand across, and you're almost bringing your shoulder blade to the bed for me. So you're just twisting like that as you inhale, and I'm just holding my tension, okay? So my first kind of tension is all I'm doing really. Now breathe in as you do that, and then the breath is doing all the work for me basically. So back again, exhale. Okay, and then I'm just going to either come up a little bit more, or I'm going to sink at a different level, okay? So a bit of protective tone there, Pete. Just holding that direction. So I've sank into the tissue. I haven't poked them, I've just sank, tension the tissue towards, along the angle of the rib, and then I'm just holding that. And Pete, I want you to twist and inhale as you do that. That's it. Good, keep going for me, keep going. That's it, we're just decreasing that protective tone there. Cool, perfect, back up again. Now we will have some serratus the higher we go here as well. So you might need to almost go through that, okay? Because serratus will be coming this way while we're going that way, okay? So your intent with your direction of force will be pretty important here, okay? Hold it there. And same again, Pete. And again, we will be influencing serratus here a little bit. So you might want to consider this as well for any shoulder pain patients as well. Okay, so again, any history of rib injuries, etc. This can have an impact on the ability of that serratus to function. Good, that's very good, Pete. Well done, much better. Okay, so he's getting a lot better already. Okay, and then we're going to do one more. And again, I'm going to hold my tension. Now, if this, you should feel the ribs start to separate under your hand. So as he rotates here, obviously these tissues are going to lengthen, so the ribs will almost start to splay a little bit, okay? And then you should just feel that tissue glide under your hand. If you can't feel the tissue go under your hand, you're poking too much, and this will be very, very tender. And again, we always use an inhale because an inhale is going to lengthen these tissues, okay? And then you can get them to exhale as they come back again. So that is a very, very useful technique. Anyone that's getting pinched in the lumbar spine with extension as well, you might want to consider this, okay? And then obviously anyone who's got pain or decreased motor output with any myofascial testing, or anyone who's getting a bit of a restriction here with twisting, it can be really, really useful exercise to do. Okay, so obviously as Pete rotates to the right, these tissues here will have to lengthen, whereas the left posterior tissues would have to lengthen. Now, if we want to get to the posterior tissues, it's pretty much just going to be the exact same, but we're just going to go with the other reach. So what I'm going to do this time is I'm going to work the other side of the intercostals. I'm just going to sink through the tissues, put my direction of force, and Peter, I just want you to reach for the floor for me. That's it. And then we're just reaching through there. That's good. And in that scenario, Peter, I want you to breathe in. And again, that's just going to get the last little bit of length. Okay, back again. Okay, save again, sink, put my tension through, and then Pete's just going to reach. Good, keep your head where it is. Let your body reach around your head rather than the other way around. That's it. And then breathe in. Good stuff. Okay, perfect. Okay, so you can do it either side of the lat. We can get the anterior side going this way. We can get the posterior side going this way. Very, very powerful techniques. If you're not comfortable with that, then what I suggest as well is just literally stripping through these tissues, okay? So literally sinking into the tissue and just following it through, okay? So just doing some massage through there as well. It works very, very well if you're not happy with this kind of tensioning and lengthening kind of approach, okay? So all we're trying to do is decrease muscle guarding here, and it can be very, very quick and very, very powerful to decrease pain in the neck, in the shoulder, in the back as well. So again, this isn't just about pain in the thoracic spine. If you think there's muscle guarding here and if it's influencing or contributing to the pain experience, then please take care of it. It can have quite quick changes. Okay, I hope you enjoyed that. Now, don't forget you can use the previous lessons in this series as well. Use the nasal breathing to drive that ribcage motion. So after you've done your desensitization techniques, make sure you're giving them that nasal breathing homework that we covered in previous lessons. It's a great way to get the intercostals to lengthen. In the Go-To Therapist Mentorship, I keep it simple. I don't want you to be able like having all these intricate cues and working really hard. I just like simple. That's where all we want you to do is get full range of motion within reason, and then let's get some low tolerance through it. And you will be surprised at the difference you can make with people. At the forefront of the Go-To Therapist Mentorship, the most important thing for me is we keep it simple so you have clarity, because when you have clarity as a therapist, that's what allows you to take action, get results with your patients. If you are clear on what you're doing, your physiology, your explanations, everything changes. If you don't really understand what you're doing, that comes across to the patient. Okay, and it's very important that you have clarity and that every single progression is the next logical progression. If you want more information on this, head over to thegotophysio.com. I've got loads of resources for you there waiting for you to help you become that go-to therapist. That's it for this lesson. In the next lesson, I'm going to give you some more gold to help even the most trickiest complex patients that have failed traditional approaches. I'll see you then.